Welcome, welcome, welcome. Another edition of IRT Physical and Hand Therapy's Health Talk. So glad to have you with us, along with Shannon O'Kelly. I'm Tom Hutler. We've got a very crowded guest list today. In addition to our two normal segments, we have a guest right off the bat here. Curt Bailey is the director of Bloodworks Northwest, Shannon. You got a chance to sit down and chat with Curt about what the great work they do. And boy, they have been really, really under a lot of pressure and duress during these last several months because of COVID.
Yeah, Tom, blood is one of these things that we always need. Human beings are always needing blood. And particularly right now with COVID, as you said, they've been kind of compressed, getting donors out, insecurities about being in public. And we're just going to talk about what are the needs out there.
All right, let's hear that conversation now with Shannon.
Curt Bailey, welcome to Health Talk. How are you?
I'm doing just fine. How are you?
I'm doing great. Thanks for joining us. Hey, Bloodworks Northwest. Tell our listeners what you do, what you're about, kind of the ins and outs of Bloodworks Northwest.
Well, Bloodworks Northwest provides blood, and we provide blood to hospitals up and down the Pacific Northwest. We're the largest blood collector and distributor for hospitals in our region, and Bloodworks has been doing this life-saving work since 1944. And in fact, we serve over 90 hospitals, both with blood and also essential testing, support healthcare in our communities in our region.
It seems like blood is always in some kind of demand. But Curt, with this pandemic and COVID and the concern, am I vaccinated, not vaccinated? Can I give blood? Is there any challenges that you're facing right now?
Well, I'll tell you, we're facing the challenge of confusion. And the confusion is the public seems to think they can't donate blood based on their vaccination status. And it doesn't matter if you've been vaccinated or not vaccinated, you can give blood. And why that's important, not enough members of the community are stepping forward, rolling up their sleeves, and donating blood.
And what's the cause of that? The need for blood is constant. And what do you think's going on? Is it the concern and confusion that you just talked about?
It's a little bit of that confusion around vaccination. And you know what? It's a little bit of that good weather in the Pacific Northwest, pandemic's easing off a little bit. Folks are probably doing some things they have wanted to do for a while, and they finally can. And they're forgetting that this need for blood never stops.
And tell us, statistically speaking, how much blood, you might have mentioned it, but how much blood do you need on a weekly, monthly basis here in the Northwest?
Well, I'll tell you, between now and Independence Day, we need 80,000 appointments scheduled.
80,000. Hear that, people? 80,000. Anybody out there, don't let confusion deter you from getting involved. Tell us how we can help you, Curt.
Well, if you're listening, go to bloodworksnw.org and schedule your appointment. And this is the important thing. We need to keep everybody safe still during the pandemic. So we have social distancing in our collection sites and our centers. So that means donors need to make an appointment so that we keep those spaces decongested, keep everybody safe. But we need 80,000 appointments between now and Independence Day. So if you make your appointment between now and then, you have helped out patients in our community.
Tell us some stories or a story that points to the need for blood and donation.
Well, blood saves lives every day. We had a patient, we had a mom who had just delivered, and at 1 a.m. in the morning, she started bleeding very heavily postpartum. And as it turns out, she continued to lose blood, and she lost 5 liters since delivery. And what was required to save that mom's life was over 40 units of blood. And in order for that blood to be provided, over 52 donors had to come in and give their life-saving blood. And that mom's life was saved right after she brought a life into the world. So that's the impact you make when you donate blood.
It's a great story and a great cause. Curt, thank you so much for your time and good luck. Get out there, you folks listening, get out there and donate blood. Thank you, Curt.
Thank you.
All right, thanks again to Curt Bailey from Bloodworks Northwest. Bloodworksnw.org has more information for you. Next up, Dr. Sarah Jurek as we continue on Como.